These are photomicrograph images of H&E stained general histology slides. This slide can be identified as hyaline cartilage by the presence of homogeneous basophilic ground substance, isogenous groups of chondrocytes forming cell nests and, to the darkly stained territorial matrix around these cell nests. In this slide of elastic cartilage we see numerous elastic fibers in the ground substance, chondrocytes and lacunae arranged single or in pairs. White fibrocartilage consists of bundles of collagen fibers, and seen between these bundles are rows of chondrocytes. In white fibrocartilage, perichondrium is absent. The slide of bone is unstained. We see the Habersian canal in the center of the Habersian system, also known as an osteon. The Volkmann's canal connecting two Habersian canals and the lacunae are seen in these slides. Important to note here that osteocytes are not seen here due to the process of slide preparation. Here we can see the differences between the microscopic features of skeletal and cardiac muscle. In case of skeletal muscle we see the nuclei flattened towards the periphery, whereas in cardiac muscle the nucleus is at the center. Striations are clearly visible in skeletal muscle and branching of individual fibers are seen in cardiac muscle. Intercalated disc, which represents the junction between two adjacent cells, is seen in cardiac muscle. Slide of nerve fiber longitudinal section is special stained, where myelin sheath of the nerve fiber appears black due to the osmic acid stain, while axons are unstained and appear white. In the microscopic anatomy of optic nerve, bundles of axons surrounding the central artery and central vein of retina are seen along with the meningeal layers forming a covering for the nerve. The differences between the spinal ganglion and sympathetic ganglion are clearly visible here. Spinal ganglion have large pseudo-unipolar neurons with large number of satellite cells surrounding it. Bundles of nerve fibers pass between the groups of ganglion cells. In case of sympathetic ganglion, the cells are smaller, multipolar and scattered with few satellite cells around each neuron. The nucleus is central in the pseudo-unipolar neuron, whereas in multipolar neurons the nucleus is eccentric in position. Here we have elastic artery with the tunica media mainly composed of elastic fibers. In the medium-sized artery the tunica media is composed of large number of smooth muscles with few elastic fibers. The internal elastic lamina is clearly visible in case of medium artery and is fenestrated to allow diffusion. Endothelium may not be seen in these slides due to the process of slide preparation. Veins have tunica adventitia as the largest layer. In the large vein we can identify the bundles of longitudinally arranged smooth muscles which assists in the propulsion of blood. The collapsed lumen of the medium-sized vein stands out here. Lymph node can be distinguished from spleen by the arrangement of lymphoid nodules right beneath the capsule in the cortex. In spleen we have red pulp and white pulp, where white pulp is represented by the lymphoid follicles with an eccentrically placed central artery. Palatine tonsil is identified by the presence of tonsillar crypts, stratified squamous non-keratinized epithelium beneath which lie the lymphatic nodules. Thymus is identified by the presence of Hassel's corpuscles. The slide of thick skin can be identified by looking at the epidermis with the stratified keratinized epithelium. The epidermis is composed of 5 layers. The stratum granulosum and stratum corneum are well appreciated in the epidermis, with the stratum lucidum intervening in between. The keratol and granules in stratum granulosum is one of the characteristic features. The dermis is composed of papillary and the reticular layer. Thin skin has similar features as the thick skin with the epidermis and dermis. Here the features which help in identification is the stratified epithelium and the appendages of skin, namely the hair follicle, erector pili muscle and the sebaceous glands. In this slide we can also appreciate the melanin granules giving the stratum basale a brownish discoloration. Placenta is identified by the presence of floating or chorionic villi and the intervillous space filled with maternal blood. The chorionic villi are characterized by the presence of syncytiotrophoblast, few cytotrophoblast cells, fetal blood vessels and the Hofbauer cells. The maternal side of the placenta can be identified by the presence of large decidual cells. Slide of umbilical cord is easy to identify, with a pair of umbilical arteries and a single umbilical vein. Intervening in between is the Wharton's jelly. This comes to the end of general histology slides. In the next video we will move on to the systemic histology.